Hi, my name is Michael Sherman, and today I'm going to be discussing my ARP final presentation, which is on drum therapy. So my question is, how can drum therapy help patients cope with less severe cases of generalized anxiety disorder, or as I'll be using it today, GAD? So some background information. We're going to be talking about a few of the modern forms of behavioral therapy, and we're also going to be discussing the ancient setting of drum therapy. So, the first form of behavioral therapy we are going to be discussing is MCT, also known as metacognitive therapy. So, metacognitive therapy is a form of therapy used by pushing the patient's levels of anxiety in order to teach the skill of coping with mental illness. Although this treatment is trusted and tested positively, it has reached its maximum potential of use. Now, the next form, which is somewhat similar to MCT, is cognitive behavioral therapy, or CBT, which is a form of therapy used by leading patients down a path of not dealing with the anxiety whatsoever. Although along with MCT, this treatment is commonly used and trusted among many psychologists, although it has reached its maximum potential of use. Now we're going to be looking at drum therapy in its ancient form. So, drum therapy was often used in ceremonial settings to bring a sense of higher power along with lowering stress. Now, we'll be looking at the next slide, which is drum therapy introduced into the modern medical field. Now, some of the benefits of drum therapy now include helping with multiple sclerosis, Alzheimer's, Tourette's syndrome, at-risk students, and mental illness and physical distress. So with multiple sclerosis, a patient named Walter Smith, who was diagnosed 5 years prior after getting a stroke, has worked with the drum therapy clinic for the past 10 years to regain full use of his left hand. Now we're going to look at Alzheimer's. The CEO of the Alzheimer's Foundation of America, Eric Hall, says it fosters some type of communication, and there is some power in the rhythm that promotes cognitive function. To see an individual in the late stages of Alzheimer's disease participate in life is incredibly monumental. Now, with Tourette's syndrome, Tourette's causes people to involuntarily cycle through repetitive shrugs, blinks, twitches, whistles, throat clearing, spoken words, and other movements. Drumming helps those with Tourette's be distracted away from the involuntary movements by reconfiguring brain activity. Now next we're going to be looking at how drumming could also help at-risk students. So a program called Drumbeat works at providing benefits to students at risk of falling down a dark path, such as dropping out or getting involved with drug use, by offering increased self-esteem, emotional control, and protective factors. Now, lastly, we're going to discuss how mental illness or physical distress can be helped by drum therapy. So, a program called Drum Like a Lady was created to help those, specifically girls, who are stressing out, have anxiety, and bipolarity. The creator of this foundation had suffered from a panic attack in work one day and was eventually fired. She was left with only her drums, and she found that the drumming had helped her go through the rough times in life. So now we're going to look at my third slide, which is the science behind drum therapy. A study done by Michael Drake of Ohio State University discusses how drum therapy helps with stress on a scientific level. Now, Drake discovered that drum therapy increases the level of alpha waves and lowers the level of beta waves in the brain. Alpha waves are one of 5 common brain waves that help to calm or relax those experiencing higher levels. Contrary to that, beta waves keep one on their toes, usually increasing anxiety and stress. Now, my last slide of background information, we're going to be discussing how all of this relates to the question. So since both MCT and CBT have maxed out their potential of use to help those suffering from GAD, drum therapy opens up a new window for new and better benefits to help those coping with their anxiety. Now, this project specifically focuses on proving that drum therapy can produce better benefits than CBT or MCT for those patients suffering from GAD. So, the testing phase. So, originally, before the COVID-19 outbreak, this test was used to discover whether drum therapy can produce better results than MCT and CBT for patients with GAD. This questionnaire used to help patients pre-treatment and post-treatment will be very similar to the GAD-7 scale, which you can see in the bottom right-hand corner. Now, originally, I was supposed to grab a group of students and break them into separate groups. And after school, when they're experiencing high levels of stress from the school year ending and possible exams or tough homework load, I was going to try to help lift some weight off their shoulders while trying to learn something new about what can be done to help those with GAD. So my hypothesis originally was based on the prior research, it is possible that drum therapy could produce better results than the prior behavioral therapy methods used before. So lastly, we're going to be discussing my conclusion and my discussion. So unfortunately, due to the recent outbreak of COVID-19, no testing was able to be done for this project. Although, due to the capacity of all my research, it is assumed that drum therapy would have produced much better results when treating patients with generalized anxiety disorder. And lastly, these are all my picture references. Now, really quick, I want to thank all of the teachers who have helped me throughout this long path of therapy for the past 2 years. And yeah, I wish it could have gone a little better, but I'm so glad I got to learn all this, and hopefully I can continue my research in the future. Thank you for listening.